Bike Day is a program where we fit kids here in pediatric rehab of all abilities to custom adaptive bikes. There are physical improvements that we can make through using these bikes, so things like improving range of motion, strength, coordination, postural control. A lot of our kids can't necessarily stand, walk, crawl on their own, and this gives them the opportunity to move independently and experience mobility in a different way. The average cost of these bikes is not something that the average family is going to be able to afford, and not something that they can grow with as well, where our kids can get a bike when they're 4 or 5, outgrow that bike or have needs change, come back to us. They'll turn that bike in to be refurbished for another child, and then they'll be able to get a new bike as they get older as well. So we're very lucky because Children's Miracle Network here at Beaumont Children's has completely taken over funding in this event, and they've grown with us over the years as our costs have increased and our program has been able to serve more kids. Bike Day is a group effort, so we have lots of corporate partners. We've got volunteers here in the department from our therapists that volunteer their time, our front office staff that volunteer their time, and we've got people that come from all over as far as our vendors as well to help with these adaptive bikes and to be able to kind of help work through fitting these kiddos and making sure that they get through this process efficiently. We typically have 2 events. We have a fitting day, we've got a delivery day. On a fitting day, a child is paired with usually a therapist team and a vendor. They'll try maybe 2 or 3 different bikes, and we're trying to see if we can optimize that bike for them. If we don't have a bike on site that works for them, we'll order that bike. They'll come back for our delivery day, usually 8 weeks or so afterwards. I started with Bike Day. This is 13, 14 years in at this point. When I started here as a young therapist, I knew early on that this was something that was special to me because it was so tangible. A lot of the kids that we see in therapy make very incremental gains, and it's amazing. We celebrate those little victories. But this is something a little bit different. This is something where we get to provide something where we get an immediate smile, we see immediate results, and it's something that has lasting effect. So I knew early on that this was going to be something that had a big impact on me, and today I'm the coordinator. When we get to do those final adjustments and the kids get to come and pick up their bike, we get all the heartstrings, we get the big smiles, we get families crying. It's a beautiful thing for everybody here, and it's a big day for everyone.